A very pleasant good morning to everyone. Welcome to the Senate Judiciary Committee. We have lots of guests, some from around the state of Wyoming this morning. Very happy to see everyone. Just a couple of housekeeping things, committee. We have some assistants this morning, some interpreters who have been good enough to join us to help us with this first bill. I have given some permission for them to be where they need to be. So I hope that's okay. They may end up here behind the dais with us, just to make sure that everyone can see them. And I know that our staff will work hard to try to include everyone in the process. Just by way of how we will approach, this morning we will take up Senate File 89, Insurance Coverage for Hearing Aids. That is a bill that Senator Furphy, I'll ask you to go out front. You're going to be presenting this morning. Ms. Davis from the governor's office, if you'd like to join Senator Furphy, that'd be great. While they do that, I would just go over the procedure a little bit. Once the bill is presented, we will give some opportunity for folks to testify. We will do that by first encouraging those in the room to testify. You're welcome to do that. We have quite a few who want to testify on this bill, so we would ask everyone to come up and be as expedited as you can be. Then we will go to those who are online this morning and allow for testimony remotely as well. So that committee, any questions before we get started this morning? Okay. First bill for our consideration is Senate File 89. Senator Furphy, walk us through this bill.
Thank you, Mr. Chairman. Before I go through the bill, Mr. Chairman, I wanted to explain the genesis of how this bill was created. I was approached by a group of hard of hearing individuals in Laramie and Cheyenne, and they expressed they are not receiving the help they need in our state. So then we scheduled a meeting with the governor's office, and Jen Davis, senior policy advisor to the governor, sat in on that meeting with the governor, and the governor was very concerned also that we're not providing the services in our state to these individuals. And so Jen spent a lot of time, and I'll let her explain what she did, but in the end, she developed this overview of findings of hard of hearing in our state. And there's a good action plan developed here. So the first step was to propose this bill that I have on providing hearing aids through insurance companies. So, Mr. Chairman, if you wouldn't mind letting Jen speak about how we developed all of this, if that's appropriate, Mr.
Senator Furphy, that would be terrific. And then I want to come back to you and have you walk us through the bill, just step by step, and kind of let us know what the bill does. But Ms. Davis, please chime in. We're anxious to hear from you. Thanks for being here.
Good morning, Chairman. Good morning, committee. My name is Jen Davis. I'm the Senior Policy Advisor for Governor Gordon for Health and Human Services. As Senator Furphy mentioned, we were approached by a group of individuals who were having some struggles with meeting requirements in Wyoming for offering services for the deaf and hard of hearing. So Governor Gordon and I sat in with the meeting. There was a request initially to establish a commission for the deaf and hard of hearing. And so Governor Gordon asked me to dig into this a little bit and find out what we had in the state, where maybe some of our gaps are, and what we might be able to look at doing to assist the community. So in that process, I held some community meetings. We also convened a group of stakeholders who provide services to the deaf and hard of hearing community across the state, and really walked through what we had in the state as far as service provisions, where they saw some of the gaps, and then came up with the report that Senator Furphy mentioned that walked through barriers, opportunities, and then there were a list of recommendations from the governor that required some executive branch action and then required some legislative branch action. So in that report, there were some recommendations for Medicaid to work on some caps in the waiver program, which Director Johansson and his team have already addressed. There was recommendations in there around coverage for hearing aids, some options for that. Other recommendations in there were considering looking at additional staffing at Department of Workforce Services, who does a lot of our service provision for the state there. So those were in the recommendation from the governor. We brought that forward to be considered as a big package of recommendations, and Senator Furphy has been very great to work with in this space and decided to take up some of those recommendations, which results in the bill that he has in front of you today.
Ms. Davis, thank you. Senator Furphy, do you want to dive into the bill and tell us what the bill does?
Thank you, Mr. Chairman. The bill itself, if you look on page 1, what it's talking about is providing insurance coverage for hearing aids. 18 other states, Mr. Chairman, have similar legislation requiring that insurance companies provide hearing aids. If you go to page 2, Mr. Chairman, it's just definitions on what a health insurance plan means. It includes individual and group health insurance policies, and it defines hearing aids. That's already in our statutes. Then it defines hearing aid professional, which means physicians, audiologists, etc. Then on page 3, we define hearing aid professional services, and the key is evaluation, fitting, programming hearing aids, and making an impression for ear molds. On the section B on page 3, here is the key. On line 18 and 19, we're only asking the insurance companies to cover hearing aid professional services when the hearing aid or aids are deemed medically necessary.
Senator Furphy, real quick on that front, you referenced 2640-102 when that reference is made. Can you tell us what specifically that does? I haven't had time to look that up this morning.
Exactly. What that does is when that statute covers the term medically necessary on all sorts of services, Mr. Chairman.
Okay.
But that's key, Mr. Chairman, to me, just because someone has some hearing loss, very mild or not significant, quite honestly, Mr. Chairman, the market now has opened up and you can buy hearing aids over the counter for a couple $100. But honestly, if you have, as described here, medically necessary, you're having probably profound or severe hearing loss, and you need to go to a professional and get it taken care of. True hearing tests, as it notes, and once you've been evaluated that you need a hearing aid, they can do things like fitting them with molds into your ear and doing it right. But I think that's important on page 3, Mr. Chairman. Then on page 4, we point out if you have insurance coverage, you're still going to be subject to the deductible, as noted on line 2, co-payments, or co-insurance provisions. So, Mr. Chairman, even though you're diagnosed needing hearing aids, you're going to have probably some skin in the game here. And then on D, it says the insurance plan may limit coverage to not more than one hearing aid per ear every 3 years. Quite honestly, hearing aids have improved so much that a lot of them last 5 years or longer, but this is what the insurance companies may need to provide if the physician or the audiologist decides you need to have them updated more often, 3 years, and no more coverage than $2,000 per year. Basically, Mr. Chairman, on page 5, we're making this out another year, July 1st, 2024. So I'll try to answer any questions. Let me note the fiscal note. So the insurance commissioner's here, and he can probably explain it better than I can, but this is the cost to cover the state employees under this plan. So I'll stop
Okay.
there, Mr. Chairman, and try to answer questions.
Thank you, Senator Furphy. Appreciate that. Questions for Senator Furphy this morning? Okay. Senator Cooper, and then we'll go to Senator Case.
Thank you, Mr. Chair. Senator Furphy, would participation in these plans be voluntary? Is this something people can opt out of?
Senator?
Yeah, if I understand your question, is it long-term disability, is it considered?
Senator, Mr. Chairman?
Go ahead.
No, sir. Is this program something that would be required for everyone when a company provides insurance, or do they have the ability to opt in and opt out of the program?
Mr. Chairman, Senator Cooper, no, they would be required to provide this under the medical insurance or disability insurance, so they can't really opt in or opt out.
Okay, Senator Case?
I was just getting your attention for Senator Cooper.
Oh, thank you. All right. Anything else, committee? Senator, thank you, and Ms. Davis, thank you. We'll go to some other folks and come back to you with questions a little bit later, okay? I want to go to our insurance department. And appreciate you folks being here this morning to help us out.
Mr. Chairman. Committee members,
Good morning.
good morning. Thank you for having us. I'm Jeff Rood, the Insurance Commissioner, along with Ms. Howard, our Deputy Commissioner. We're neutral on the bill. We just wanted to be here for questions. We wanted to note that we've worked with Senator Furphy on this and the governor's office. We've answered some questions and gave some suggestions. But we truly wanted to be here for the fiscal note if there's any questions with that, because our portion of the fiscal note said we could not determine the decrease that would occur in the general funds. And I don't know if you want me to go into an explanation of how that decrease would occur or not. Happy to do it. I'll try to be brief.
Commissioner,
Okay.
I would like that very much, because frankly, I was going to ask the question on the fiscal note. So thanks. Appreciate you guys.
So, Mr. Chairman, when the ACA came out, they came up with a benchmark plan, 10 essential health care coverages that were for every plan.
Can I ask you to get a little closer to the microphone?
Certainly.
Commissioner?
Sorry.
Thank you very much.
And so you had these 10, a minimum of 10 things covered in the ACA. And if a state had 5 additional things before the ACA, that was also rolled into it, and the federal government would pay for all of those essential health benefits. In the case of Wyoming, we did not have, for example, hearing aid coverage. So now that we're adding it to, if it were to go into effect and we would mandate it, it would become an essential health benefit coverage, and the state would have to defer the cost for the rules of CMS. And what happens is the insurers who pay out on the ACA plans keep a tally, they file a report, a document with us at the end of the year, and we reduce their premium tax by that amount. So what would go into the general fund as a premium tax would be reduced, whatever that figure is for this type of coverage. And we tried to, we made some inquiries with the health department. We tried to do some open source document review to see possibly how many people that would be, and it was just indeterminate in the time we had. So we really can't tell you what that ultimate decrease in the general fund would be.
Commissioner, I appreciate that. I'm riding a little slower horse this morning. So that I'm trying to picture taking that up to the chamber and trying to explain what you just said to the rest of our senators up there. And frankly, I'm not quite there. Go ahead, Senator Case.
Let me point out that your horse is far superior to the mules that Cooper and I are riding.
No, I'm not sure. That little Shetland pony. Anyway, so Commissioner, back to you on this. So I'm trying to get my arms around why this is this costly. Under a state plan, you kind of have to guess how many under state coverage would qualify as being medically, medical necessity. So that was a little bit of a surprising figure to me. Can you talk about that a little bit?
Mr. Chairman, there's 2 parts to the fiscal note, and it's hard to differentiate them. They're just kind of merged together.
Okay.
Our part is the part that says we don't know what the answer is. The part that has numbers comes from the state plan, and I think you can hear directly from them how they calculated those numbers that are in the fiscal note. But our portion of the fiscal note basically says it's indeterminable at this point the cost of that the insurers would pay for this, which ultimately would be borne by the state. But Mr. Hayes is here if you'd like to know the specific numbers that are in the fiscal note, because I certainly don't want to touch that.
We're hoping to visit with Mr. Hayes, by golly. It's good of him to be here too. Questions for the insurance department? Senator Schuler.
Thank you, Mr. Chairman. Yeah, the fiscal note is probably the biggest question I had on this, really. And I understand that it's difficult to determine, but in there it assumes that, everyone would basically have a purchase. And I just kept thinking, would it be easier to take a look at maybe the age of some of the folks that are in those departments. I don't know if A&I actually took a look at that. I don't know if it's more age geared toward older folks or just what.
Commissioner, go
Mr.
ahead.
Chairman, Senator Schuler, I think Mr. Hayes might be able to comment about that. We're left with, we know there were 37,000 plus people that signed up for the Affordable Care Act plan this coming year. And that's more than we've had before. I just don't know the breakdown of who's who needs a hearing aid, who's of which age group. So,
Commissioner, can you give me that total again?
Mr. Chairman, I want to say 37,500 is pretty close.
So good morning, Mr. Hayes. Thank you. Some of these questions did boil over into your pot. So we're anxious to hear any thoughts you have on this fiscal note and what you can help us with.
Good morning, Mr. Chairman, members of the committee. My name is Ralph Hayes. I'm the manager of the Employees and Officials Group Insurance Program, and we did prepare this fiscal note. Now, one of the things you have to understand that this program covers over 38,000 people. So this is a large program, which is really reflected in the numbers here. Plus, we have a wide range of individuals plus retirees on this plan. So we have a whole lot of folks who are over age 50. And basically, once you start getting on the mature side like myself and past that, the need for hearing aids goes up fairly dramatically, and they are expensive. Now, I will note that, while the bill does say once every 3 years, there's that provision right after it that says, or when medically necessary. So what we did is we went to the actuaries at Cigna, who are experts in this, and they have expertise in looking at populations and their age and the prevalence of hearing aids. And they were able to come up with these numbers for us.
So really, Mr. Hayes, this medically necessary piece isn't necessarily those with a lifetime deficiency. You have to cover those of us like me who are climbing the age ladder, right? That obviously comes into play.
Mr. Chairman, you're absolutely correct. Anytime we have some sort of hearing loss, an audiologist will tell you, you need a hearing aid. And so that's going to become medically necessary. If you lose a hearing aid, it's going to be medically necessary for you to replace it, even if you just bought it 6 months ago. If you damage the hearing aid, it has to be replaced. So that's medically necessary. That's why when I look at that once every 3 years, that really goes out the window because of the medically necessary language.
Questions for Mr. Hayes? Go ahead, Senator Case.
Thank you, Mr. Chairman. I think I'm understanding this. So medically necessary doesn't mean required by prescription. Or do they go hand in hand, or how does that work?
Mr. Hayes?
Mr. Chairman, Senator Case, when you look at medically necessary, that's a pretty broad term.
Yeah.
And it's applied a little bit differently in your different medical arenas. Cancer is medically necessary, a lot higher bar. But when we start looking at, let's look at prescriptions for glasses. You have any loss where you really need them to see clearly, it's medically necessary. The same applies to hearing aids. So if I have a little deficiency and my partner says, you need to get a hearing aid because you never hear me. Well, that might be selective, maybe not. But I go to an audiologist and they say, yes,
We
you
have
do
fought
have some
that
hearing
battle.
deficiency, and to bring it up to a normal level, yes, it becomes medically necessary. So in this preparation, we did say one hearing aid every 2 years because we do believe some are going to go 5 years, as was mentioned earlier, but some are going to be replaced much sooner than that because of loss or damage, or maybe it doesn't fit quite properly. There's a lot of reasons why people get hearing aids replaced on a regular basis.
Go ahead, Senator Case. Yep.
I'm sorry, Mr. Chairman. So how do you even know that the hearing aid would be for an individual? I mean, how could I get my insurance and cover someone else in my family, even though I'm covered? I mean, I'm not asking the question very well, but supposing I submit a claim for a hearing aid, and actually the truth is it's for someone else in my family. Is that possible, or how do you keep that from happening?
Mr. Hayes?
Mr. Chairman, Senator Case, when we look at this, your bill is going to be specific for an individual. So there's going to be an itemized bill with a patient and a diagnosis and the quote unquote prescription. I don't know if there's an indication of how much hearing loss is out there, but it will be person specific. We wouldn't pay, or say, I should say, Cigna wouldn't pay a bill that had no name on it.
Right.
It does require that it be a covered patient under the program.
So, Mr. Chairman,
Go
back
ahead,
to my
Senator.
earlier question about a prescription, it seems that that's the way you get the record, is you go get a prescription, they recommend the hearing aid, you get the hearing aid, and that's what you submit the invoice for that ties back to the prescription. So this bill wouldn't fund hearing aids. I've been reading that hearing aids can now be obtained over the counter, and so you can go to different places and get hearing aids. So does that break down the prescription you need for the verification or not? And maybe I'm too far in the weeds here, and I apologize. If I am, Mr. Chairman, pull me back.
So Director, go ahead. Yeah.
Mr. Chairman, Senator Case, no, I can buy a hearing aid over the counter for, if I wanted to go hunting and I wanted to hear better in the field. No, we would not cover those. It would have to come through an audiologist with a prescription. But that is what Cigna is actually looking at here, is there is a prescription, there is an audiologist, and all the fitting and everything that goes with it. So while yes, you can buy them over the counter, and sometimes people do because of the cost associated with hearing aids. But in this particular case, no, we're not taking those into account.
So, okay, thank you. Well, I actually want to take us back up to the 30,000-foot view here. And for any one of you, can you talk to me about, we're not just talking about our state plan. If we pass this law, it would cover, it would require in the state of Wyoming any insurance company to provide this coverage, would it not? Or is this
Mr. Chairman,
Go
members
ahead,
of the
Mr.
committee,
Hayes.
absolutely. The way this bill is written, any insurer in the state, including self-funding schools like the K through 12 districts and cities, towns, and counties, plus the private sector, including the healthcare exchange, all of those programs would be required to cover hearing aids as described under this piece of legislation.
And so, Director, fundamentally, that means that the populace needs to step up because the insurance plans will have to cover this additional coverage that we're requiring. Do I have that straight, Commissioner?
Mr. Chairman, and I didn't explain it very well, and I apologize for that. The fiscal note is confusing because it deals with two different populations, and then now we're talking about a third population. I deal with the population that are on the that have an Affordable Care Act plan, those 37,500. Those are the ones that I can't really determine because I don't know the demographics. I just don't. Mr. Hayes works with EGI, the 38,000 people. He knows his demographic pretty doggone well. He's got all their information. And then we've got the rest of the state and all of their coverages. In those instances, coverage will have to be made, and that'll be something that the underwriters will look at, and they'll fold it into their premiums in the future. I hope that helps.
It does, Commissioner. And, I'm just trying in the back of my mind to get a feeling for those of us who would be willing to step up a little bit to help our population that needs these. We can expect to pay a little bit more on our insurance, correct?
Mr. Chairman, that's just how insurance works. We don't have a lot of exclusions. You have a policy. And my policy covers many things that I will never, ever need or would never possibly need, but it's there and it's rolled into the policy.
Yeah. Committee, further questions for the insurance panel? Really appreciate you guys. We reserve the right to ask a question later if we need to. Thanks, you guys. Okay. Is there any other state agency folks here this morning? And I apologize if I've missed you, or please come forward. Thank you.
Good morning, Mr. Chairman, members of the committee. Lee Grossman with the Wyoming Department of Health, Division of Healthcare Financing. Effective February 6th, I'm the Wyoming State Medicaid agent. I offer that just to manage expectations in terms of questions you may have for me this morning. Neutral on the bill, but want to provide some information in terms of how we would see this impacting the Medicaid program. Presently, the limitation in Wyoming Medicaid is that we cover hearing aids every 5 years. With the provision of every 3 years, we would expect to see some additional costs there. Just for some high-level information for you, we currently, in any given year, this varies obviously, between 200 to 400 individuals on Wyoming Medicaid will receive these types of services with a price tag from an annual basis ranging anywhere from about 600,000 up to $1 million. So just a real high-level estimate, we'd probably be looking in the ballpark of approximately 150,000 in terms of an increase to annual expenditures. To the medical necessity piece, we currently require that for any hearing aids that we pay for, so no changes there. I can keep it very simple and give you more time back unless there's any questions, Mr. Chairman.
Mr. Grossman, thanks for being here. Sorry I didn't see you back behind the corner there, but we do appreciate you being here. Any questions for the Department of Health? We thank you. Go ahead, Senator Furphy.
Thank you, Mr. Chairman. Let me ask you, if we amended this bill from 3 years to 5 years, are you saying it'd be neutral to the state Medicaid? Thank you.
Mr. Grossman, go ahead.
Mr. Chairman, Senator Furphy, yes, that's correct.
Okay. Thank you very much. We appreciate it. Thanks for being here this morning. Please come forward. I thought maybe Workforce Services was here, by golly. Good morning.
Good morning, Mr. Chairman, members of the committee. I'm Holly McCamey Simone. I'm the Workforce Program Administrator for Department of Workforce Services. And I oversee, one of the programs I oversee is vocational rehabilitation. So I wanted to provide some background and some data points on the proposed legislation. Vocational rehabilitation actively works with more than 4,000 of Wyoming's citizens with disabilities and helps them establish and reach vocational goals that help them to be productive working citizens. One of the VR services that we provide is rehabilitation technology, and this includes hearing aids for individuals that we are assisting with obtaining and maintaining employment. In review of our hearing aid expenditures, VR spends between $350,000 and $400,000 per federal fiscal year, which serves approximately 115 clients in Wyoming with hearing aids each year. In the past 4 years, we have spent $1.6 million on hearing aids and those related services. This is our second highest expenditure next to college and training programs. Specifically in 2022, we paid $367,000 for hearing aids for 96 clients, and that equates to approximately $3,800 per client who had no insurance or other comparable benefit. The life cycle of a hearing aid is approximately 5 years, and as a result, we have 30% of clients that we've closed successfully who return to us for additional hearing aids, which further adds to our client service cost. Often we are assisting a person who is already employed with the purchase of hearing aids to help them maintain their employment. Examples of those that we have served are college professors, industry professionals, youth who aren't able to hear in their high school or college classroom, and people aging and needing hearing aids to maintain their employment. At least 45% of the clients we purchase hearing aids for have private insurance that does not cover these necessary devices to maintain their employment, and that equates to about $800,000 over those 4 years. If hearing aids were covered by insurance, this would impact vocational rehabilitation budgets by freeing up service funds for our other clients. Thank you, Mr. Chairman, and with that, I would answer any questions that you may have.
Ms. Simon, thank you very much for being here. That last point you made, I think, is significant. Can you remind us what that impact would be again?
So currently, in the past 4 years, we've spent a total of 1.6 million on hearing aid and those related services. And then we did a sample of how many of our clients did have insurance or comparable benefits, and about 45% of them do. So if this bill were to pass, that would potentially give us an additional 800,000 over those 4 years that we could use for services for other clients.
Appreciate that. Questions? Senator Case.
Mr. Chairman, thank you very much, and thank you for being here and testifying. That number seems large, but I'm guessing that in your case, vocational services, there's kind of more than just going and getting plugged in for a hearing aid. There's probably just a lot more to that whole expenditure. But you mentioned $3,800 per client that required them. That strikes me as up there, but help me with that a little bit. And how do you think that compares perhaps to more of the general population that would be going in? What would, can we speculate about what the implications are? Apologize, I may be out of your area, but I think
No,
you're
that-
smart on this.
No. Ms.
Thank
Simon, go
you,
ahead. Yeah.
Mr. Chairman, Senator Case. We do have clients that come in with multiple disabilities, so we might be providing other services other than hearing aids. However, the data that we pulled particularly focused on those folks that came in specifically for hearing aids. So I hope I'm answering that question. And then we utilize typically an audiologist that would do that evaluation and get very prescribed about what type of hearing aid they would need. And so when we looked at our average per client of what we pay for hearing aids, it's around $3,800. Now, some require a hearing aid with a lot more technology or different capabilities, and some require just the basic hearing aid. Did I answer your question, sir?
Senator Case, go ahead.
Mr. Chairman, thank you. I think you did a really good try, and probably better than my question deserved. It just seems like a high number, and I'm thinking, well, your clients are more
Profound.
maybe intense needs. I don't know quite and maybe they have more back and forth with the therapist to get the hearing aid to work properly, to have it be, or maybe they're ultra sophisticated hearing aids, whereas the general population, chances are, wouldn't be in that high-end hearing aid. And I actually, that $3,800 just kind of shocked me a little bit.
Mm-hmm.
But
So comments, Ms. Hyman, go ahead.
I'm really
Miss-
sorry.
No, you're fine. Mr. Chairman, Senator Case, we have a range of clients that we serve. So some do need very sophisticated hearing aids,
Right.
and some need something that's basic, but we do use that audiology report to determine that. We are a least cost agency. So if someone, we have an audiologist report and the person wants, we joke maybe a little bit, the Cadillac of hearing aids, we typically pay for the generic model, or not the generic, but maybe the Ford or something like that. So we take that really into consideration, that we're a least cost agency, because that helps us provide services to multiple clients. I do have a breakdown for you, sir, with hearing examinations and the hearing and speech therapy. That's about 32,000 per year. The bulk of our expense are those hearing aids, and that is our third highest, or second highest cost for our program per year.
Really great. Thank you.
Thank you. Yeah, appreciate it. Anything else, committee? Holly, thank you very much for being here. It's very helpful.
Thank you, Mr.
Thank
Chairman,
you.
members of the committee.
Okay, I think no other agency folks are with us this morning, so I'm going to go to public testimony on Senate File 93, Senate File 89, insurance coverage for hearing aids. I would welcome anyone who would like to testify on the bill this morning. Good morning. Please come forward. welcome. I would ask that you, we have met, but please state your name for the record. Thank you.
Good morning, Mr. Chairman, members of the committee. My name is Heather Roday, and I'm from Blue Cross Blue Shield, and I'm joined by my colleague, Rocky Red. Wanted to talk a little bit about Blue Cross Blue Shield of Wyoming for you. We are a not-for-profit company that's been based in Wyoming for over 75 years. We are the smallest plan in the Blue Cross Blue Shield Association, and all of our operating decisions are made locally. We don't report to shareholders. And so we cover 125,000 Wyoming members and 85,000 additional members through national agreements. And all these folks depend on us to help make healthcare more affordable through our insurance products. When healthcare costs increase, unfortunately, Blue Cross must pass these increases on to members through higher premiums. And in some cases, business clients may also see their healthcare costs escalate. Growth of healthcare costs hits customers, and unfortunately, legislation where coverage is mandated often takes money out of Wyomingites' pockets. Therefore, Wyoming also has some of the most expensive healthcare costs in the country, and we always voice concerns when there's legislation brought forward which can increase costs. Regarding this bill specifically, Blue Cross Blue Shield provides health insurance coverage to individuals on the ACA marketplace through our QHP plans, and the Department of Insurance has spoken a little bit about that. So we have plans that would be impacted by the defrayal parts of this bill. We also have other plans impacted by the requirements. So we also wanted to again say that the FDA has approved the sale of equivalent over-the-counter hearing aids that are available at substantially lesser cost through retail outlets. And this bill doesn't mention that option as a way to spend dollars more efficiently. We are concerned that this bill will cause additional costs to the insurer for marketplace plans and potentially and non-marketplace plans requiring higher reimbursement for hearing aids that are needed should they be purchased over the counter. So we are concerned that this will increase costs to our plans, but also to the state when the defrayal is offered. And so therefore, we oppose this bill. Rocky, do you have any other comments?
Thank you, Heather. I think Heather covered it, and we would stand for questions, Mr.
Can you
Chairman.
state your name again for us, please?
Sorry,
Thank you. No problem.
it's Raymond Joseph Red II, but you're welcome to call me Rocky. That's what
Okay.
most people call me. So
All right.
if you saw my name badge, and she called me Rocky, but so I think she covered it, Mr. Chairman, and members of the committee. I think the most challenging part of this bill for us is the defrayal requirements. I know that the insurance department spoke about that, but it is a complex proposition to talk about how defrayal works. We've read through some of the national benefit payment parameters guidance on it, and there's some things that we have to take into consideration. One of those things I wanted to mention today is that state mandates are not factored into the percent of premium that will be attributed to essential health benefits, which is used to calculate premium tax credits. So we have to take that into consideration when there's a state mandate, that we can't take that into consideration into the premium. And I know that the insurance department talked about the tax credit, but it's not something we can factor in when we do our reporting to the federal government. So that's something we have to kind of split up from our premium tax and the way that it works. So in the guidance, it says that the defrayal can be sent directly to the enrollees, can be sent directly to the insurance company on behalf of the enrollees. And then there's also this actuarial analysis that hasn't been performed. I think HHS recommends that it's done prospectively so that you can kind of see what the impact will be. And that hasn't occurred. So that would be something that we would have to consider going back to the insurance department's testimony that it's undeterminable what the cost will be right now, that actuarial analysis will need to be performed. And that would either be performed by the insurance companies or the insurance department. And that's something we're going to have to collaborate on in order to determine the real impact of this.
So this morning, you can't tell us what impact there might be on each of your 125,000 Wyomingites who carry Blue Cross. You can't give us an idea of how much impact that might be to their insurance plan?
That's correct, Mr. Chairman. I think, we know that some of this cost we'll have to bear for those plans that are not QHPs, qualified health plans. But for those plans that are qualified health plans, this is not currently an essential health benefit. So that would have to be carried by the state. And then the cost that is not part of a QHP would have to be borne by us and our members. So there's some that would be borne by the insurance company, passed on to the members, some that would be borne by the state.
When you talk about a tax credit, I'm assuming that's a tax credit that is given to Blue Cross as a company. You can't claim tax credits. Is that a cost driver as well to this? Is that the point that you're making on that front?
Mr. Chairman, that is a complex question I've been thinking about ever since I've been
I was
looking at this
afraid of
bill.
that.
And what I would say is that in the past, for other state mandates, the insurance department has provided Blue Cross Blue Shield of Wyoming with a tax credit for the cost to defray. But with respect to the way that HHS has been looking at it now, we are not allowed to take into account the cost of this into our own premium calculations. And so that's where it becomes complicated. It's the advanced premium tax credit that members receive really wouldn't be a part of that calculation. So we can't pass the premium cost onto our members because it's a state mandate that isn't a federal mandate. And because the state's deferring it, we really can't use that premium calculation as part of any of the tax credits we get through the federal government. Now, I know that the insurance department is saying that they would provide a tax credit to us from the state. But with our calculations and the way that we calculate things, it becomes a little bit more of a complicated proposition.
Okay, thank you. Further questions? Go ahead, Senator Schuler.
Thank you, Mr. Chairman. Yeah, one of the questions that I was going to ask was that how this would affect the premiums of those that have private insurance. So it sounds like that's complicated, so we'll worry about that later. But just a question on, you talked a little bit about the over-the-counter hearing aids. I'm just wondering how effective those are, if you have any kind of data or statistics on that versus a Cadillac one. And actually, I'd really like to know how much each of those would be, or maybe an average cost to hearing aids, if you know that information. Thank you.
I think the senator is asking for a friend who's sitting beside her. Do those things work?
Mr. Chairman, Senator Schuler, that's a great question. With respect to what we've done in our research, I can't really opine on exactly the efficacy of the over-the-counter hearing aids. I'm not completely sure. I'm sure that there's some things that can be accomplished through prescriptions and through those professionals that prescribe hearing aids that can't be done over the counter, but I really can't speak to that. I can say that there's other types of hearing aids. They're not really hearing aids. We're talking about cochlear implants, bone anchored hearing aids, those kinds of things. Those are different, at least from our perspective, from just a hearing aid that sits on the ear. So there are more complex procedures that are associated with people's hearing loss. What I can say is that some of our plans cover basic hearing aids, like our FEP program. Some of our plans cover bone anchored hearing or cochlear implants, but don't cover the regular hearing aids that this bill would cover. So I can speak to that, but I can't really speak to the over-the-counter. So.
Okay, committee, I think we're going to try to move on. Appreciate Blue Cross being here. Further testimony on the bill this morning, Senate File 89. Please come forward. Feel free to come forward. Glad to have you here. We would ask that you identify yourself for the record. let us know. Wonderful. Thank you for being here. If you would for us, please speak into the microphone.
I can do that, but at the same time, I might need to transfer this to my sign. I'm not, well, okay. I'm John Dixon. I have lived here ever since I was born here, but I've been here since I was 1, and I am completely deaf. I don't have my hearing aids with me right now because my benefit, they're not successful right now, but I can tell you that when I was growing up in the school district, even after the school district, that hearing aids that need to be covered by insurance would be a wonderful thing, because the cost of hearing aids is so great for me. And right now, I'm looking at, if I get hearing aids, I'm looking at $4,000 to $5,000 per hearing aid, because I have such a greater hearing loss. So I'm open to any questions you may have regarding hearing aid use, regarding cost of purchasing hearing aids, whatever. But I do think this is a beneficial program that needs to be assessed further. So,
Really appreciate you being here. Thank you for your testimony. Are there questions, committee? Any questions? Senator Cooper.
Thank you, Mr. Chairman. Sir, were you mainstream to the schools, or did you go to a deaf school in Wyoming?
I was mainstream at Chinese Thai.
At Cheyenne?
Yeah.
Okay, thank you.
Wonderful. Thank you very much for being here this morning. We may fire a question later.
That's fine. I'm more than happy to answer any question.
Thank you very much. We would appreciate anyone else who would like to testify on Senate File 89. Anyone else like to testify? Don't be bashful. Please come forward. We're glad to have you here. And there needs to be a green light on your microphone. Okay. Yeah. If you could please introduce yourself so we have your name in the record.
My name is Allison Cunningham, and I live in Laramie, Wyoming.
Good morning.
Good morning. It's nice to meet you all. I know some of you. I've been following LSO and what's going on in the legislature. And many bills I support and some I don't, but it's good to follow what's happening with the legislative committees.
Thank you for that.
You're welcome, Mr. Chairman. So regarding my hearing, hearing aids are really important for me, Chairman and committee members. I have an issue with a lot of wax in my ears, so accumulating in my ears, so that requires me to go to an ENT, an ear, nose, and throat doctor quite often to get that cleaned out. And also going to an audiologist, and all those are really high expenses. I need a hearing aid that's pretty sophisticated. it's between 28, in the past, if I have 2 hearing aids, I can't just have one, I need both of them. Sometimes I benefit more with 2 hearing aids as opposed to 1. So that it's about over $2,000 per. And I have to replace mine quite often, and that's very costly. I can hear environmental sounds, but I am profoundly deaf, and I need to have hearing aids for my safety. And insurance, insurance companies will pay for a cochlear implant, but they won't pay for hearing aids. And cochlear implants are way more expensive than that, than hearing aids. And I don't qualify for a cochlear implant. And I just want to, I want to have hearing aids. The doctor did tell me that I don't qualify for cochlear implants. And I need to have these hearing aids so I can hear environmental sounds that, you know, for my basic rights. Wyoming insurance companies refuse to pay for hearing aids. The Wyoming Constitution, Section 1, Section 38A, healthcare access. No one, especially deaf children, can be discriminated against getting hearing aids. And anyone who is against this bill will see later, you know, when they start to lose their hearing aid in their older age, they'll totally understand because it is so not accessible. You know, whether they, you know, get into an accident, whether they get sick and lose their hearing, whether they lose their hearing from old age. There's no room for discrimination here, Chairman. And Wyoming is the equality state. We need to follow that motto. And we need to support each other here in Wyoming and not discriminate against each other. We need to help each other.
Ms. Cunningham,
Any questions?
thank you very much. Committee, any questions for Ms. Cunningham this morning? Thank you very much. We really appreciate you driving over from Laramie to be here this morning. Much appreciated.
You're welcome.
Further testimony. Please don't be bashful. We want to keep going so we can get through this bill. We have a couple other bills after this one, so we want to keep going. We welcome testimony. Please come forward. Introduce yourself for us. Good morning.
Good morning, Chairman and Senators. My name is Dylan, and I am here from Afton, Wyoming.
Please proceed. Yeah.
Thank you. I'm deaf, and hearing aids are medically necessary for me. I hadn't used hearing aids for about 5 years, and boy, it was really hard for me. Then I learned ASL, American Sign Language. And I was involved in acting for a few years. And that really helped. Once I got hearing aids, it really helped me and my quality of life. If I don't have my hearing aids in, I cannot hear. That means I can't hear my hearing friends or many other people who don't understand sign language. If I need new hearing aids, I have to buy them. Insurance will not help me at all. Insurance only helps every 5 years, and technology, as you know, changes so much these days. So technology, boy, has changed a lot, and to wait 5 years, that's pretty impossible. And I just got new hearing aids a few months ago, actually in August. And my last one, gosh, before that was really old. But, there was different technology. It didn't connect with my phone, my cell phone. And now these new hearing aids, they connect with my cell phone, with the Bluetooth. And because with Wyoming Relay, that agency has helped me a lot with the assistive technology with my hearing aids. New devices have closed captions with hearing aids and phones, so I can talk to a person and do that independently without an interpreter, because I can have closed captioning on the phone through this technology. Whether I'm talking with someone over the phone or in person, I will know what they're saying. Not many people know American Sign Language here in Wyoming. And people are just spread out all over the state. So I depend on my hearing aids to be dependent and successful. And my hearing aids help me to work with other people. And, when I'm at meetings with people, I know things can be challenging, whatever challenges I have. It's just really important for me to use my hearing aids and have that new technology that comes with that, especially in the community where I am. And I'm hoping that, I think Wyoming needs to be here to help each other and help other deaf people. And we want our voice to be heard, and we want this to happen. Thank you for your time, Chairman and committee members.
Dylan, all the way from Afton, thank you for coming to the Capitol today. We appreciate your testimony, and I hope you enjoy your day here at the Capitol. Thank you. Questions for Dylan? Senator Schuler.
Thank you, Mr. Chairman. I'm just wondering, again, not knowing much about hearing aids, I'm wondering about the cost of these new updated ones that you have that seem like they're much more effective. And if you wouldn't mind sharing, I'd be interested in knowing what that would cost.
So these types of hearing aids, Senator, they were almost they probably cost $100 or more. But with new technology, that cost increases more. More than, it could be more than $2,000, $2,500, so per hearing aid.
Thank you again, Dylan. Appreciate you coming. Further testimony, please come forward. Please state your name for us this morning for the record. Welcome.
Thank you, Chair. My name is Chelsea. So I thank you. It was a pleasure to meet all of the senators and the chair today in the committee. I am completely deaf. I have had a cochlear implant back in the 90s. For that implant, I had to go to Denver. I was a teenager myself at the time. I had to do a lot of testing. We had to drive quite a bit. It was a lot of back and forth. My parents at the time paid for it because insurance only covered a very minimal amount if I was to choose hearing aids. With cochlear implants requires about every 3 months to have an appointment to have the technology. And unfortunately for me, it was not successful. So that again was in the 90s. And so going back forth, I never was able to use the implants. I haven't been able to use hearing aids since then because of that. And I'm happy to answer any questions.
Thank you very much. Any questions, committee? Thank you so much for being here this morning. Really appreciate that.
You're welcome. It was my pleasure. Thank you, Senator and chairs.
Okay, further testimony? Further testimony on Senate File 89? Is there anyone else in the room that would like to testify? Okay. Good morning.
I'm just going to talk.
Okay.
Okay. My name is Catherine. I'm from Casper. And I'm cooking implant user for 7 years. I raised human hand for many years. Till about 7 years ago, my hearing went down a little bit. I couldn't hear nothing from my hearing. So my audiology told me I was qualified for cochlear implant. So that means I had to fly to Denver every year, every 2 years, depending on the weather. It takes that rough. But I was so lucky that my insurance covered all of it. It cost me $200,000 in pain, surgery. Yeah, I really my dream to school. And tell that stood in Montana for 2 years. Yeah, and I learned a lot about hearing aid and cochlear implant and my insurance. And I would like me to have insurance to cover all the people who would like to hear things.
Catherine, thank you. You're from my hometown.
Yeah,
Appreciate
I've met 2 people. And we have met before.
Appreciate you being here this morning. Thank you very much. Further testimony on Senate File 89.
Hello.
Good morning.
Good morning. My name's Carissa LeBeau. I'm also from Afton, Wyoming, like Dylan. I traveled very long way to be here today. I wanted to give you guys a hearing perspective on this bill. I'm what you call a CODA, a child of deaf adults. I'm here with my parents today, Patty and Philip LeBeau. And I just wanted to say I've had so much experience with hearing aids my entire life. My dad is a user of hearing aids. My mother used hearing aids when she was a child, but they were not successful for her. She said, and I quote, it sounded like nails on a chalkboard for her. But my dad, hearing aids have greatly benefited his life. my dad's mother, my grandmother, she did not believe in the plight of deaf people when he was born. She didn't believe in deaf access. She didn't believe in language for deaf people. She just wanted deaf people to be hearing people. I'm very thankful to say that she is not like that anymore. She has come a long way, and she is very accepting and loving now. But as a plight to make my dad hearing as a child, she had him in hearing aids, speech classes, all that jazz. And he, if you talk to him today, he could use his voice. You would hear him. You would understand him very clearly. He speaks like you and I, but he cannot hear you at all. His hearing aids help so he can hear the environment around him. I've heard you say a couple things about hunting today. I know a lot of you are outdoorsmen. He loves that. It helps him if he wants to go hunting, he can hear something, a predator approaching behind him, or a gunshot off in the distance, or something that otherwise he would not be able to hear. And my life has been greatly impacted by hearing aids because of their expense. So hearing aids, in my research that I've been doing over the last week or so, can cost over $6,000. They're very expensive. My father needs new hearing aids about every 5 years. I've gone with him to those appointments. They're very educating, and sounds weird, but I think everybody should experience one. And then I've also had my grandfather, who in the last about 8 years of his life used hearing aids, and they were also about $5,000. And all my life, I've been impacted by that cost. I grew up in a low-income household. It's not easy for deaf people to find jobs in the US, especially well-paying jobs. And so already in a low-income household where both my parents were educators, when a new hearing aid was needed, that was a priority. And we had mac and cheese for dinner for a month straight. That was just what we had to do. Maybe just like cream of mushroom soup mixed into some noodles. And that was our dinner, because insurance companies don't want to cover this hearing aid, everything. Most, like, I think Senator Murphy said they cover about 18 states cover hearing aids. And I'm sorry for my voice is shaking. I'm not a public speaker.
You're doing awesome.
And I want to make sure I cover all my bases, but I also remember in those last 8 years of my grandpa's life, my grandpa renovated homes until the day he died. He was about 80, I want to say, when he passed away, maybe older than that. And it was always such a big expense. And I think now when I've been doing this research for this bill, like how much better those last years of my grandpa's life could have been if he didn't have to think about the price of hearing aids. And he was getting a family discount too from a family friend who was giving him this discount. He was still paying $5,000 for his hearing aids. And I'm sure I forgot something, but that's what I wanted to say.
Can you do me a favor? And
Yes.
the committee missed your name.
Carissa LeBeau.
Carissa, thank you very much for making the trip here. Really appreciate it, and I hope you enjoy your day at the Capitol.
Thank you.
Very well done. Any questions? Thank you so much.
Thank
Really
you for hearing me
appreciate
today,
it.
Chairman.
Nicely done. Any further testimony on Senate File 89? Further testimony on Senate File 89. We'll keep marching through this so we can get through the bill.
Hello.
morning.
Good morning, Chairman Landon. I was not planning to testify this morning, but I would like to share a few things. My name is Scott, last name Four, and I own one of the only educational consulting firms and sign language interpreter agencies within the state of Wyoming, and at least owned and operated within the state of Wyoming. There are many other states agencies that come into our state as well. To my knowledge, Wyoming is the only state in the union that does not have a school for the deaf, a commission for the deaf, or a nonprofit supporting deaf people of all ages. And perhaps Jen has done much more extensive research than I have, so she may be able to correct me if I'm wrong. But it has been heartbreaking for me. I've lived in Wyoming for the last 8 years. And I quit my teaching job because I couldn't get sign language interpreters for my students. I'm sorry, I have to hold back tears. I had to quit teaching deaf children because I needed sign language interpreters. And so I went back to school to become a sign language interpreter, and I opened up an agency. I quit teaching American Sign Language at the University of Wyoming as well. And this bill will have a life-changing impact for a lot of deaf and hard of hearing people in this state. And I have so much more that I wanted to say because there was a lot of misinformation out there that you guys have that's been reported, and I just all escapes me because I'm an emotional wreck. So please excuse me. But thank you for considering this bill, and thank you, Senator Furphy, for bringing it forward.
Thank you very much. Before you leave, I just want to make sure the committee doesn't have any questions. Appreciate the work you do. Thanks for that. And it helps us to know that this service exists because of you. You've got a company here. Anyway, Scott, thank you very much. Yeah, appreciate it. Any further testimony on Senate File 89 here in the room? Here in the room, any further testimony? Okay, please come forward. We'll keep marching through. Good morning.
Thank you, Chairman. My name is Chris Folsom. I'm currently a graduate student at University of Wyoming, and I traveled in from Laramie today. I have congenital hearing loss that has gotten worsened with age. I currently wear hearing aids, but I wasn't able to afford them until about a year ago. I've always loved school, but by the end of my time in college, not being able to hear became one of the center obstacles of my life. And in my pursuit of a degree, which I did acquire a Bachelor's of Science in Physiology in May of 2019. But I had to make sure I could arrive to classes incredibly early to sit in the front row or close to it. If I didn't do that, I wasn't able to follow along with the class. There were also several jobs I worked that I quit after a few months because I wasn't able to hear well enough to perform the work. And because I more recently had a substantial loss in hearing, and because it was more mild earlier, I don't know ASL. Fortunately, when the pandemic hit, I got a job working remotely at the Wyoming Department of Health. And because this job was entirely remote and on my computer, I was able to work within the confines of my disability. And I was also able to move in with relatives and save on rent. And over the course of about a year and a half, I was able to finally afford hearing aids, which were about $2,500 hearing aid, I believe. But I just want to emphasize I had many enormous privileges and was really lucky to be able to do this. And I think many hard of hearing people wouldn't find themselves in a situation where they could save up like that. And I also want to emphasize that owning hearing aids has augmented every part of my life. It gave me the confidence to apply for graduate school, the ability to perform my graduate work. It's given me the tools to be an effective teaching assistant. I'm about to begin TAing our intro to biology course this fall. And it's allowed me to get involved in my community and volunteer with a number of organizations in my free time, all of which were things that I just didn't think I could imagine myself doing without hearing aids. And it's given me the confidence to testify here today. And in short, the crux of my argument is that I've been able to be involved and support my community in many ways as a result of acquiring hearing aids. I've taken on a teaching role. I'm involved in what I consider important research now. I help others when I can. And I think all variables accounted for that the value of that productivity has likely outweighed the initial cost of hearing aids, or if it hasn't yet, I believe at one point it will. And just in general, I believe that when hard of hearing people are given access to this resource, they're able to reach their full potential and as a result provide more to their community. So I think it's worth the initial cost. Thank you.
Chris, wonderful job. Great job. And thanks for paying it forward.
Thanks.
All that you're doing. That's really well done. Any questions for Chris this morning? Thank you so much. Really appreciate you coming over. Further testimony in the room for Senate File 89. Anyone else like to testify on Senate File 89? Judy, do we have anyone online that would like to testify?
Excuse me, Mr. Chairman, we have two people with their hands up online.
Okay, if you could please let them in, Judy, and I would ask that you turn on your video and unmute your computer so that we can hear you this morning. Please identify who you are for the record. Good morning. Let's, who do we want to start with? Okay, do we want to start with Stephanie, maybe?
Stephanie, can you turn on your microphone?
Okay.
Okay, I'm just double checking here. Can you guys hear me okay?
We can. Good morning. We can.
Good morning. So I'll try to keep it sweet. Mr. Chairman, thank you for meeting with me today and allowing me to share my statement with you guys. If I may introduce myself, my name is Stephanie Hernandez. I am a deaf education specialist for Fremont County, Wyoming. I reside in Riverton, and I have resided in Riverton for the last 15 years. My husband was born and raised here. I was also born with bilateral profound hearing loss. And for many people that might not know what that is, that's basically, if you look at an audiogram, it's basically the lowest that you can go. It's the deaf can possibly get. So I'm nervous, so you have to excuse me. I honestly would not be where I am today without my hearing aid. So what makes me me? My hearing aid have indeed shaped me into the person you see before you. So I started off to check my first pair at 5 months old, and I'm now 41 years old. So think about that for a minute. If you want to do the math, between my parents and I, we have spent enough on hearing aid over the course of 41 years to purchase a brand new home, maybe 2 homes. But mind you, today's price in the 3.6 cents higher than the average price since 1980. We know that, inflation and all that. Hearing aids were only about $750 in the 80s a piece. Now, for the type and degree and configuration of hearing loss that I have, being born with a profound hearing loss, my hearing aid cost $10,000. Because I'm not late onset, and I don't have mild loss, and I don't have congenital loss. I have sensory neural loss that I was born with. So my hearing aid, when I last checked with my audiologist for the type and brand that I need to have for my type of loss, is $4,598 per parent, totaling a whopping $9,500 to $10,000 after testing. And we know that the hearing aids are not deemed medically necessary. They're not subjected to taxation. So they're gonna have a higher tax dollar amount attached to that figure too. So if we fast forward to today, I do the math. Only 25 states require health insurance companies to cover a portion of the cost of hearing aids for children. Not adults, that's only for children. So the number for adults, it dropped down to only 5 states. So right now, the only states that cover hearing aid costs for adults are Arkansas, Connecticut, Illinois, New Hampshire, and Rhode Island. And the cost that they're offering is only a measuring $700 to $1,500 per hearing aid. And with this bill, it would be 2,000 per hearing aid, so that would be amazing. So if you think about that, like I said, my hearing aids are 5,000 a piece. So if we had 2,000 per ear, that would cut the cost in half for me, and that would be really handy. Let me share my dilemma with you. A few years ago, I bought a new pair of hearing aids, and they were $5,000 altogether. But here's the problem. They're not the right kind of hearing aids for my type of hearing loss. They don't work very well. But I might do. I gotta take what I can get, can do it all I could afford. But I know if I had the right hearing aid, I would be able to perform the functions and the duties of my job more efficiently. So we also have to take into consideration that we have, no, this is not the state of Wyoming, but we have over 38 million people aged 18 and older with hearing loss in the country. I don't know what the number is in Wyoming. I think the last time we checked it was around 25,000 people with hearing loss, but I could be wrong. We need to double check that with Jen and Scott Ford. But I also wanted to refute the previous statements that somebody made. I've been taking notes throughout the whole meeting. So somebody had mentioned that cochlear implant and BAHAs were covered by private and employer covered insurance plans or whatnot. That's actually not true, because I've been an employee of the state of Wyoming for the last several years, and my insurance won't even cover cochlear implant, even if I wanted them. I checked, I looked into it because I thought it might be something that I can do for myself. Unfortunately, for the type and degree of hearing loss that I have, cochlear implants do not work for me. But when I did go through the process of trying to obtain them, to my surprise, my insurance company doesn't even cover them. And I've had Schindler and Blue Cross. So that's actually a, yeah. The Affordable Care Act doesn't cover hearing aids, and we have to remember the majority of the people that are on Medicaid are children. How many of those kids have hearing loss? I don't know. Somebody needs to come up with those numbers. But adults are not covered by Medicaid programs unless they have a disability that is noted, like Social Security income. But what about the rest of us who are working employees and working citizens of the state who do not qualify for those Medicaid programs? And I guess I just want to close with this. I drive about 1.5 hours every day to my job. I have to make a decision between buying a gas efficient car with the gas prices we're having today, and I drive a truck, okay? It's a gas guzzler. And I'm thinking, okay, this isn't gonna work. I'm spending $100 a week in gas going to work every day. I need to make some changes. I would like to buy a more gas efficient car for my job and for my family's pocket. However, I also need my Oticon hearing aids that cost $10,000. So I have to make a decision. Do I want a more gas efficient car and get me a work, or do I want the hearing aid so I can do my job at work? And it's silly that we have to pick and choose like that.
So, Ms. Hines, I'm going to have to interrupt this morning.
Jeff,
I really appreciate your testimony, but we do want to try to get to the bill.
I got to know if you guys could, with the bill, it would reduce the cost of the hearing aid by $4,000 for many of us. That's allowing individuals like myself to be able to afford the right kind of hearing aid fitted for the type, degree, and configuration of the hearing loss that I have. So that's all I have to say. And if you have any questions about the cost of hearing aids, or I remember previously one of the senators mentioned something about sharing the hearing aid, like you coming in and saying, I want to get the hearing aid for myself, but then you give them to someone else. That doesn't necessarily work because the hearing aids are designed and programmed for the type and configuration of hearing loss that you have. So if you try and give them to someone else, they're not going to work. And you have to think about the ear mode too. Everyone's ear mode is shaped differently. So sharing is just out of the question when it comes to hearing aids.
Thank
Thank you,
you.
guys. I appreciate it.
Well, thank you very much. We appreciate you sharing lots of information with us this morning, and thank you for being here, Ms. Hine. Thank you very much. Any questions, committee? Okay, thank you very much. We want to go to, we have one other individual, I believe, joining us remotely. Judy, if you could let her in, please.
Kim Ryman, and you need to turn on your microphone. Thank you.
Kim, I don't have your last name. I apologize. Please introduce yourself. Good morning.
Good morning, Mr. Chairman and members of the committee. My name is Kim Ryman, and I am from Casper, Wyoming. And thank you for listening to everybody testify regarding the Senate File 89 and the importance of hearing aid insurance coverage for, I would say, adults. I am the mother of 3 children, and they're all born and raised in Casper, and they're all currently attending the University of Wyoming. My oldest daughter was born with a moderate to moderately severe hearing loss, and she was fitted with hearing aids at 8 months of age. And she continually lost hearing to where she's now profoundly deaf, and she is a bilateral cochlear implant user. My middle daughter had a unilateral hearing loss with one frequency since the age of 7 that we monitored her whole life until she hit the age of 21. And she now has lost significant hearing and now is a bilateral hearing aid user. And it's because of my journey raising these 2 children with hearing loss that I'm a supporter of improving services and access to resources for individuals who are deaf or hard of hearing in the state of Wyoming. And I believe that Senate File may potentially provide assistance as part of the solution for adult hearing aid users. You know, as you've heard today, the cost of hearing aids can be upwards about $6,000 a pair. And my considerations I'd like you to consider is that if this should pass, that fitting infants, toddlers, and children with hearing aids is a specific specialty for adult hearing aid fittings. And I'm concerned that this may potentially have unwanted and unintended consequences for children in the state of Wyoming. Since 2012, the Wyoming legislature has effectively met the needs of children, the needs of deaf or hard of hearing children through the Wyoming Children's Hearing Aid Program. And my hopes that are with or without this passage of the Senate File 89, that Wyoming Children's Hearing Aid Program will remain intact as it has been so as it pertains to infants, toddlers, and school-age children. These YCHAP funds are spent judiciously with reduced fitting fees, hearing aid fees, and ensures that infants, toddlers, and children through the end of their high school career can be fitted appropriately with amplification. And I'm concerned that over-the-counter hearing aids, they're not effective, and it's imperative that infants, toddlers, and children be fit in a timely manner and appropriately so that they can have access to spoken language and sound so that they can learn. And I know that YCHAP has built-in safeguards to ensure timely and appropriate fitting of hearing devices for infants, toddlers, and children. And since its inception in 2012, YCHAP has allowed for over 181 infants, toddlers, and children to receive timely and appropriate fitting of hearing aids. Thank you. That's just my concern to know that infants, toddlers, and children needing hearing aids are different than adults. And I really just want to ensure that those safeguards are in effect, whether that this Senate file passes or not. Thank you.
Ms. Ryman, thank you very much for being here this morning. Really appreciate your testimony, and we will discuss and try to assure that that program is in no way affected. Appreciate you reminding of how important that is. Any questions for Mrs. Ryman this morning? Okay. Kim, thank you very much for being here. Really appreciate it.
Thank you.
Okay. Committee, that takes us through the testimony on this bill. I'm going to
I'd like to really thank the family for coming over from Afton. I grew up in a deaf family. My oldest brother is deaf mute, and I understand the issues that they're going through. Every one of us kids learned to sign before we learned to speak. And my nieces and nephews the same way. And when they're just little bitty, 12, 14 months old, they're already signing. So it's a way of life rather than just a disability. It's I'd like to speak to the gentleman who said there are no deaf schools in Wyoming. My brother went to school in Colorado from the time he was 5 years old, and in Colorado Springs. And my mother said the hardest thing she ever had to do in her life was take that little 5-year-old boy, set him down on the porch and walk away and not be able to tell him why. So he got to come home at Christmas and at Easter and in the summer. So we spent our lives without my brother in our house. So it's not an easy thing. The deaf community is a lot larger than you'd suspect, and the discrimination against them is severe. It's real and it is severe. We've come a long way with technology, with the hearing aids. We've come a long way with education. When my brother was wanting to go to school, the only school available to him was Guyadec, and we didn't have the money, so he didn't have the opportunity to go to college. It affected his whole life. It really did. So this is something we really need to address. We're really talking about two different types of hearing aids. The type that I wear is a box store type hearing aid, $2,500 for a set. But that's not what these folks are talking about. Many of these are just like the young lady from Stephanie said, $8,000, $10,000, $12,000 a piece. I mean, it's for a set. So it is very significant. It's something we need to address. I don't know that we really know what the cost would be for insurance. I think that's something maybe before we end up passing the bill that we really need to understand what the cost is going to be to individuals all across the state, because it is going to impact every healthcare plan in the state. So that's a number that we need before we can really get definitive answers, I think. But this is something that, in my opinion, really needs to be explored a lot further. There are real issues here that need to be addressed. We do need to protect the children. I think that's imperative. So that's my thoughts on the thing.
Senator Cooper, thank you. Further discussion on Senate File 89. Senator Case.
Mr. Chairman, I'm very moved by these great people in the testimony today. I'm not a supporter of the bill, but I want to know more about services for children and the Wyoming Children's Hearing Aid Program. That was mentioned. I don't know where that program is. It might be in the Department of Education. I'm not real sure. I'm looking at a website for it, but it's not clear. I also heard some testimony that children tend to be covered under insurance in more states than adults. I'm sort of interested in that. I see definitely the value of covering children, making sure they're covered. It's more of an affordability issue in terms of plans on adults, but I could be persuaded to try to help children more, for sure. And the testimony was very moving here. Believe me, I can tell it. So
Senator, thank you for your comments. Appreciate
Thank you,
it.
sir.
Senator Schuler.
Thank you, Mr. Chairman. I also am very pleased with everyone that came and testified today and appreciate the long hours it takes. I know I'm on the west side of the state, so I know how far it is from Star Valley here. So appreciate that, and not great roads all the time. And so in essence, I'm in support of the bill. I think it's going to be a hard sell up on the floor. Obviously, there are going to be some that might consider this an overreach. But I kind of think about it in terms of, I pay for pharmacy for Medicare. I guess that tells you how old I am. But I don't use any medications. But I consider that a service that, older folks need. I might be the only one on this panel that doesn't wear a hearing aid, but somewhere down the line, I may. But I'm not thinking in terms of me, I'm thinking in terms of our folks out in Wyoming. And I know that there are folks out there that are having a tough time. We shouldn't have to make that decision between, our quality of life, basic necessities, food, so on and so forth, not being able to work because of this and the inability to be able to pay for hearing aids. So I'm in support of the bill. I like I said, I think it's going to be a tough road to hoe upstairs, but appreciate all those that came.
Okay, thank you, Senator Schuler. Any further discussion? Committee, just a couple of things from my standpoint. I have some real concerns about the impact and specifically the fact that we're not quite sure what the impact is going to be across the state through all of these insurance plans. That's overshadowed by the fact that really great testimony this morning that leads me to support this bill to get it upstairs at least into the Senate chamber so that we can continue the conversation about this. In Wyoming, we help each other. I think this bill can be a vehicle to keep the needle moving, as Senator Cooper pointed out. Appreciate the work of the governor's office. Jen, thank you for everything that you brought to the table this morning. So for that reason, I'm inclined to support the bill. Keep it moving, keep working on it, keep finding out everything that we can, and we'll see where it goes. But just want to thank everyone for making the effort to come to Cheyenne and to testify and join us today. This is how the process works, and we really appreciate all of you. Okay, committee, so let's go to work on the bill. It's been moved by Senator Cooper, I believe. Are there any proposed amendments? Senator Furphy, I thought maybe you had one for page 4 that you were considering. Are we good with that 3-year period? Are we interested in considering a 5-year period? Senator Furphy, I'm not pressuring or anything, but I just wanted to remind that we talked about that.
Yeah, this program, when it first started, we had it even richer than it is now. So we made adjustments to lower. So yes, Mr. Chairman, I'll propose that amendment, changing from every 3 years to every 5 years.
So Senator Furphy moves that we change 3 years to 5 years. Does that appear in 2 places in that paragraph? Senator Furphy, do we have to change both of those?
Yes.
Lines 8 and
So on line 8, where it shows 3 years, change that to 5. And on line 12, 3 years, 5 year.
Okay, discussion. All in favor of Senator Furphy's motion, please say aye.
Aye.
Any opposed, no? Okay, that motion carries. So Judy, did you get that amendment okay? Yes. All right. Anything else on Senate File 89? Senator Case.
Mr. Chairman, Mr. Chairman, probably won't go, but I would propose on page 4 to limit it to individuals that are under 21. And so I would, thinking out loud, I'm suggesting page 4, line 19. I was going to insert a clause in that sentence that says, subject to subsection D of this section, the coverage provided for hearing aids and associated hearing aid professional services shall be available to anyone under the age of 21 and be limited only by medical necessity to 2640-102. And I don't know if we have to get the wording right. I may be uphill on this, Mr. Chairman, so you could check that out first.
Okay, discussion on the amendment. Proposed amendment by Senator Case.
And Mr. Chairman, I just advocate that I get it. Children should not be disadvantaged anywhere in America based on disabilities. And we have to cover them any way that we can. I think the adult story is different. And so that's why I'm proposing the amendment.
Mr. Chairman.
Senator Cooper.
I think that the need is across the board. I personally would speak against the limitation for the age, but that's my personal choice.
Okay, thank you, Senator Cooper. Anything else, senators? Senator Furphy.
Thank you, Mr. Chairman. Most children are covered under the Y chat program, I think it's described. So they're already covered, most of the children. I'm debating whether that would harm to make that change in here or not. But may not hurt to include children. Okay, well, I just want to make that point that most children are covered under the chat program.
Committee, I will say that this proposed amendment probably gives it a better opportunity as it moves through the process. I'm a little bit torn because I see the need across the board, but I see where the senator's going with this. Anyway, you ready for the question? All those in favor of Senator Case's motion, please say aye.
Aye.
Any opposed? No.
No.
Okay, that motion fails. We're back on the bill. I think that can certainly be something brought forward again upstairs. Are you ready for a question on the bill? Judy, please take roll on Senate File 89.
Senator Case,
No.
Senator Cooper,
Aye.
Senator Furphy,
Aye.
Senator Schuler,
Aye.
Chairman Landon.
Aye.
Mr. Chairman, Senate File 89 has 4 ayes, as amended, has 4 ayes and 1 no.
Okay, Senate File 89 has passed the Judiciary Committee. That bill will go to the Wyoming Senate and be considered probably later on this week. And if it passes a couple of readings, it will continue on perhaps to the House. We'll have to see when it gets up to the Wyoming Senate.
Mr. Chairman,
Senator Cooper.
is there anyone here that can help us come up with some estimated cost, what this is going to cost insurance wise? Because without those numbers, I seriously doubt that we'll be able to get this through the floor. So we're going to need some numbers from either Ms. Davis at the state or from Blue Cross or somebody that can give us some really good information of where we're headed.
Appreciate that, Senator. And Ms. Davis, I know this is a little bit of a tough lift, and I'm looking back at Mr. Hayes. I know it's tough, but anything you can provide in this area of the world, I think would be very helpful. Whether the bill goes up or down, it would help all of us to know the depth and breadth of what we're talking about here. Okay, so thank you both, and we look forward to hearing anything that you can find for us. Good point made, Mr. Vice Chairman. So, committee, we're going to keep moving. I'd like to get through this next bill. At least it doesn't look as though we're going to get to Senate File 129, but let's try to get through Senate File 120 this morning. Restoration of Civil Rights, sponsored by Senator Barlow. Senator Barlow, good morning.
Good morning, Mr. Chairman.
Thank you for being here.
At your pleasure, Mr. Chairman. I know the governor's office is here, and I think their bill would be much shorter if you wanted to take mine, because I know there's people in the audience that are going to testify on this bill as well. So at your pleasure, I'll start on the bill. I'll make it very brief. We'll get to the public testimony, and then we can go back and work the bill but it's your pleasure, Mr. Chairman.
You think we should take the third one?
Who's got more people to testify on the bill?
I feel like folks are here to testify on Senate File 120. Is there anyone here to testify on Senate File 129? Okay. Is Jen still, is Becky still here? I tell you what, let's continue, Senator Barlow. Let's see if we can get through Senate File 120. Please take it away.
Thank you, Mr. Chairman. Thank you, committee, for the opportunity to present this bill to you. This is, as all the bills that I bring are bills that come out of a request out of my constituency or my community. And as you know, about 5 or 6 years ago, we had the discussion and passed a law or passed the statutes that allow people to have their voting rights restored. This bill is an extension of that. It is restoring people's the entirety of their civil rights after they've been convicted or pled guilty or convicted of a crime. For me, this is an issue. You can talk about cruel and unusual punishment, i.e. losing your rights forever. And it's based on federal law currently. It's not based on state law. It's based on federal law, your firearm rights. Only the juror rights and the public office rights are state law, and of course your voting rights. So we have a path already for partial restoration. What this is extending that. Now this has two components, and I'm trying to be brief. It's two components. One is for nonviolent felonies, which is the same standard as we have for the voting rights. If you're a violent felon, you do not have an avenue to have your voting rights restored except for pardon by the governor. That's it. That's the only one. This bill does not change that. The second one, the second part of this bill is for domestic violent misdemeanors. So this is domestic violence, and this is also a federal prohibition. This is not a state prohibition. This is a federal prohibition currently in law. So what this bill does, and I'm just going to kind of give the broad overview, and then we'll walk through the bill, and I've given you a prepared amendment that I visited with advocates about, specific to the domestic violence, and I've also spoken with some other folks, and there's some other adjustments within that. So this bill has basically two components. One, we actually rescind their rights, take their rights away in state law, because that is the clear path to actually being able to restore their rights in state law, by state law. So currently, rights are taken away, particularly firearm rights, and actually only firearms are taken away by federal law. What this bill does is, no, we're going to take them away by state law also, so then we can restore them by state law. That's the path forward. I've looked at the court cases, and I have a lot of background materials from our LSO staff and from other states, how this is being done in other states. And this seems to be expungement doesn't work. The 10th Circuit has said expungement doesn't work because the record doesn't go away. It's just hidden. It's still there. So this seems to me, at least in my understanding as a, I guess, non-legal mind, this seems to be the path forward to doing this. So two components, take the rights away, restore the rights. Two components within the restoration, that is both the DV and the domestic violence and the felony. The felony is essentially automatic. Restore your voting rights, and a period of time passes, and you haven't had a subsequent conviction, you can receive the remainder of your rights, including firearms, juror, and et cetera. And the DV requires, in this bill, the way it's currently drafted, it requires a review and I improperly placed where that review happens, should not be in the Department of Corrections, should be actually with the court of jurisdiction, where it was actually removed. And that's, and if the bill goes forward with the DV part, that'll be an amendment you could either offer or I will offer to correct that. So there is a fiscal note because this actually takes people to send in applications, and the department wants to make sure they can handle them in an appropriate manner. So this bill would need to be referred to committee number 2. Mr. Chairman, without walking through the bill, I'd be glad to stand for questions, and then I think we want to get to public testimony. Thank you, Mr. Chairman.
Any questions thus far, committee? Senator, I think it would be good timing for us to walk through and get a good sense of what the bill does. And at the very least, Senator, my hope is to get through some testimony, and if we end up needing to carry this over to Friday, we will do that. And we will also carry over 129 if needed. So please proceed.
Thank you, Mr. Chairman. So this bill goes primarily into Title VI, Title VII, and then there will be an amendment that brings in some references to Title 35. First page of the bill, this is new language. I mean, this is second page of the bill, excuse me. Violent felony, this is already in statute. And what my intent was not to go in and start making other judgment calls, but to actually establish the process. We can make judgment calls as a body, of course, about should this crime or that crime not be or should be a violent felony. I'm not making any decisions on that. I'm just trying to provide consistency. So what you'll see on page 2 is you'll see a new, and if there's a reference here that you don't know what the crime is, I can point it. I know I have them all written down in my hopefully I have them all written down on mine. So line 11, there's 2 references there, 6-2-13-14, sexual abuse of someone less than 13 years old. Both of those are refer to that. So you know what that is. That's a violent crime. I have one addition, and then the next one is 6-2-5-11, domestic battery against a household member. So you can see the kind of crimes we're talking about. What's added, and this is added to make it consistent with the section below. What's added is bodily injury to a peace officer as a violent crime. Because if you look below to 68102, if you have pled guilty to this crime or any violent or any felony, a violent crime or this felony, you also are convicted of a felony. So I just wanted to make the 2 consistent. If you don't want to do that, I understand, but I just want to be consistent about what we're considering a violent felony and which you would also lose your rights to. Page 3, this is where we go into, this is all new language in statute, and this is where we go into the domestic violence. Now, domestic violence is a catch-all, includes domestic assault, battery, and several other things that the proponents will bring forth against household members. And I'm going to draw a blank on them, but it's not, domestic violence isn't a crime in itself. It's a group of crimes that are considered under the federal law. So this is where that brought in. And basically what we're also doing here is saying, look, if we're taking their rights away. We're taking their rights away to have a firearm. So this one takes the right, if you can't have a firearm, then you go to the bottom of page 3. Currently, as I said, when you're convicted of a felony, you lose 3 rights: voting, juror, and hold a public office. This bill and the approach I take to it takes away your firearm rights too. So the state can takes them away, so thus they can restore them. The next part, page 4, is the DV, and this is domestic violence, misdemeanor. There are crimes that elevate. You can have your third domestic violence type of charge, it automatically elevates to a felony. So there are some nuances to that, but you can get to that maybe even within the same instance if there's multiple crimes, you're convicted of multiple crimes. That's my understanding. So this is more the domestic violence part. Obviously, you only use your firearms rights in this one by federal law, and if this bill were passed, by state law as well. The next, page 5, the bottom of page 5 is the meat of the restoration. What we've covered so far is the loss of the right. Bottom of page 5 is the restoration, and it's hard to put it in. I mean, maybe the verbiage isn't as good as we would like, and I certainly can continue to work on that. But basically, if you have qualified to have your voting rights restored as a felon, and a period of time of 5 years, not more than 5 years, or the length of your sentence has passed, then you are eligible to receive the rest of your rights. And the reason to put that, I guess there's two reasons. One is recidivism, because voting rights are now automatic when you've completed your sentence and probation. And there's a 3 years, I think if you look at the statistics, 3 years. So I just went out to 5 years. Said 5 years, no additional convictions, felony convictions. You've restored your rights, because the restoration of rights requires currently the Department of Corrections to make a determination. So I don't want a second process. I want to say you've had your voting rights restored, thus period of time passes, no additional convictions, your voting rights can be restored. So that's taken care of on the bottom of page 5 and the top of page 6. Now, to be clear, the way our voting rights restoration is, and this one follows in that, it's a one strike, and that's it. You get a second felony, you are no longer eligible for the restoration of any of your rights or your voting rights under current law, any other rights under this bill. So like I said, I'm not trying to change the policy of the state of Wyoming, just the extension of it to these other rights. What the legislature has done previously, just trying to extend it to these other rights with some caveats. The bottom of page 6, Mr. Chairman, new language in G. This is specific to the domestic violence misdemeanors. And this is where, you'll hear testimony from the Department of Corrections. This is where it should be the court of jurisdiction, district court of jurisdiction, not the Department of Corrections, because misdemeanor actually doesn't deal with the Department of Corrections in the same way that the court would. And there has to be a determination, because we're talking about something as, let's be honest, you're going to hear witness impacts, people have been impacted, their families have been impacted by domestic violence. I do not take this lightly to bring this forth, but I think it's a worthy discussion to have. And if we're going to have the completeness of the discussion, this needs to be a part of it. So it would actually, if we go on to page 6, there are, this is the process of what would be done. They're no longer on lines 5 through 8. After reviewing the application, and if it was amended to say the court, this would be the court of jurisdiction, excuse me, Mr. Chairman, they would no longer a substantial, maybe it should be any danger, but danger to himself, the victim, and society. This says or, but I should say and society, so that we do not have, a tragedy. So, which got the person probably there to begin with. So, and harm somebody else without question, or they lost their life. So I'm very sensitive that this is challenging. I think, and then the rest of it, Mr. Chairman, is just process as we go through. So I'd be glad to stand for any questions, Mr. Chairman.
Committee questions for the sponsor. Senator Furphy.
Thank you, Mr. Chairman. Page 6, Romanette II. So after reviewing an application to restore rights.
7.
Is that page 7,
Yep.
Senator?
Yes.
Page 7? Okay.
Page 7, sorry. Page 7, Romanette II. After reviewing the application and the criminal record, the applicant does not present a substantial danger to himself, the victim of the person's crime. My question is simply, what if the applicant goes out and commits a crime against the person they were originally sentenced for? Does the department have liability under that instance? Thank you, Mr. Chairman.
Thank you, Mr. Chairman.
Thoughts on that?
So after potentially rights are restored, do they have, we have government immunity, so I would say no, but we don't want that to happen to begin with. So you're going to hear from Ms. Muir and the advocacy she works for that there's some additional language that we would like put in there, and probably taking it to the court is the right place to, not the not the department. And that's on me. That's just trying to find the right place to do the right things. The department was the right place for the felonies. I still believe that. It's not the right place for the DV. The place that took their rights away, i.e. the court for these misdemeanors, is the right place for theirs. So to the point of, is there a liability? Well, there's certainly a social liability, but is there a monetary liability? That's something different. And we want to protect against that, the social liability, as best we can, without question. So there is an amendment, I've provided it to the committee, that I think hopefully will speak to that, and I will work. I commit to this committee, and I've already committed to the advocates on the DV component of this, that I want it to be right. I want them to feel we're in a place that we honor the very difficult challenges that they've had, losses that they've had, and still try to have a process that makes sense. If we can't get there, the DV comes out. Now, there's some good reasons to have the DV, because right now we don't have a way to actually enforce some of the challenges we have with the DV, because it's based on federal law. So it's a mixed bag, but I certainly appreciate the concern, and it's the social liability that I'm more concerned about, or I'm most concerned about, and I think we all will be. Thank you, Mr. Chairman. Thank you.
So, Senator, thanks for the considerations on the domestic violence front. The Senate and the House have spent a lot of energy these past 4 or 5 years in particular, trying to get some good work done. So that piece I really appreciate, and I do commend the effort on the amendment. I think that will help. Yeah, that's one that we've got to thread a needle, and I want to be sure we get that one right, because we've done too much good work there to turn our back on that. But further questions?
Thank you, Mr. Chairman.
For the senator. Any further questions? Okay, Senator, thank you for walking us through the bill. I'd like to go first of all to the Department of Corrections. If you guys would come forward. Thank you for your patience this morning, and thanks for being here. Good morning. Welcome back.
Good morning, Mr. Chairman, City Senate Judiciary Committee members. My name is Dan Shannon. I'm the Director for the Department of Corrections. To my left is Kayla Opedal. She's the Deputy Administrator of Programs that oversees our restoration program. So I may have to call on a lifeline here for some questions. Mr. Chairman, committee members, I just have a few comments. Senate File 120, the restoration of civil rights. The Department of Corrections is charged with taking individuals, some are worse in our society, and make them better individuals, and we return them back. That's what our end goal is. It doesn't always work, but we try our best. With that being said, the data is pretty clear that when individuals' rights are restored, that they become better members of our community, and recidivism rate clearly goes down. I just have a few comments. On page 2, line 6 through 13, it expands the definition of a violent felony. It means some individuals that we have, since back in 2010, a department has restored voter rights, so that these individuals were not going to go back and rescind because they've had a violent felony. So it'll only be upon signature July 1st, 2023. On page 5, lines 16 through 21, specifically the language on line 19, once a person has completed the person's sentence, I believe the bill writer or senator was very clear about that. It would be upon completion of the sentence, and then after that, we would take a review, a period of time of their history to restore their opportunity to become a juror or elected official. On page 6, lines 4 through 12, that's reference to the addendum that we submitted regarding the opportunity to maybe be reviewed by appropriations. In 2000, with the restoration of the voting rights, our records go back electronically to 2010. Beyond that, we do them manually. So we went back from 2018 to 2010. It took two individuals 18 months to go back just during that period. So in the event that we would restore the rights, we're asking that we have one AWAC position to get caught up, because we would be completely overwhelmed with that. And lastly, Senator Barlow made the comment that there would be an amendment regarding domestic violence. We make security judgments and are based on assessments, and these assessments are completed on someone that we have supervision, either during incarceration or while they're in the community. There's a lot of individuals that are sentenced to domestic violence misdemeanors that our department doesn't supervise. We currently have 262 individuals under that crime under supervision today in our community, but a lot of courts do not refer misdemeanors to the Department of Corrections. Therefore, we strongly support that it's not in our interest to make that determination regarding firearm rights. Mr. Chairman, I'll stand for questions.
Questions of the director? Questions? Director, thank you. We have lots to learn. I have lots to learn, and look forward to conversations if and when the bill moves forward. I appreciate you guys. Thank you.
Thank you, Mr.
And we
Chairman.
may have questions later this morning.
Certainly.
Further testimony on Senate File 120, and please come forward if you do have. We will try our best to get through some testimony this morning, and obviously we're going to have to carry 120 over to Friday morning. So rest assured, we won't just drop the bill and leave it forever. We'll pick it up again on Friday, but I'd like to get through some testimony. So, Ms. Muir, good morning.
Good morning, Chairman. My name is Debbie Richardson, and my daughter was Crystal Town, who was shot and killed by her husband in a domestic violence situation 9.5 years ago. I am not against guns. I'm against the people who have the guns. And I feel like before they get a chance to have their guns back, they need to make sure that their anger issues, and if they're on medication, that they stay on the medication. And I would be scared to death if the felon would get out and have a gun. I still would not trust that. And, luckily he will not be out. He got a life sentence. So that even misdemeanors, I just don't trust them. Even after 5 years, if we're going to do this, I think it needs to be 10 years or even more, or not at all. And the thing is are these people, he said, that they do not see in the corrections, are they getting the help that they need for their anger issues? And make sure if they're on medication for mental illness, which a lot of this is with mental illness, are they getting the help? Will they stay on that path? And that's where I am concerned about this.
Ms. Richardson, sorry for your loss. And thank you for your testimony. Appreciate it. Questions for Ms. Richardson? That's a very astute set of points. It comes right to a very important part of the bill. And so, as you can tell, we've already expressed our desire to get that right. And so thank you for that. Senator Case.
Mr. Chairman, I really appreciate you coming in. We don't want to ever give gun rights back to violent felons. Never. I don't think any of us does, or anybody in the room. This is kind of thread the needle with the misdemeanor.
Right.
And that depends on how the crime is charged, but murder or assault with a firearm, I can never imagine anyone ever on this committee wanting to give their rights back for firearms. So rest assured, I'll be watching that for you. I am interested in finding a way to help people that are have misdemeanor convictions. So thank you so much.
It's just that, you know, I want to make sure that, I mean, it only takes one shot. And if that person, I mean, they could go 5 years, but if that person gets jealous or angry, you know, that's where I'm worried. I just want them to be able to get the help that they need, that we can reassure that people will be safe. Thank you, Senator Case.
Very helpful.
Mr. Chairman, just
Senator,
one more
go
small
ahead.
thing. So
Absolutely.
I've had previous bills in this area too, and a person would be, under the previous bills, they would be ineligible for this, for restoration, if a firearm was part of the crime that they committed. So, you know, if it was threatened with a firearm, discharge of a firearm, assault with a firearm, I wouldn't support being eligible. So you've made, your point's been well made, ma'am. Thank you, and bless you.
Thank you, Senator. Something to consider as we move forward. Ms. Muir, good morning. Nice to see you.
Good morning. Thank you, Senator, Chairman Landon, other senators. Thank you for hearing this bill today. I know we are short on time, but holding it over might be the thing because we do want to get this right. I am the Public Policy Director for the Wyoming Coalition Against Domestic Violence and Sexual Assault. I work on behalf of survivors of these crimes, as well as our network of crisis programs and shelters across the state. We talk to hundreds of victims every day. We have a silent witness initiative that honors those who have been murdered by an intimate partner. That's how I became friends with Debbie. Again, thank you for hearing this bill, and a big thank you to Senator Barlow, who worked with me to propose the amendments that have been drafted. And I appreciate the comments already that we want to get this right. I hope I can address some of those amendments as I give my testimony, because without it, we can't support the bill.
So, Ms. Muir,
Yes.
I think what we might consider doing, that's a substantial amendment that we want to make sure that we understand completely. We're going to do that Monday morning. And my inclination is to put 120 up right away on Friday morning, 7:30, and to go to work on that amendment. And not to interrupt your testimony this morning, but unfortunately, we are running out of time. So to your point, I think your testimony would be well served to have the amendment there. We can walk it through with you. And in the meantime, the sponsor of the bill and any members of the committee, let's converse in the meantime, and we may have another amendment or two that can make the bill even better. Senator, thanks for getting it up today. We'll continue on Friday with it, and I look forward to that. So we'll see everybody on Friday. We are adjourned for today. We will take up both the bills that we intended to get to today.